I think the work that you do is so important to the communities that we all live in, and more importantly, so important to the families and the individuals that live within those communities.
He is one of those rare secretaries that is committed to this work, substance abuse and mental health. He's been to all the state hospitals. He knows the majority of you in this room. He's worked with you for many years and has a great, I think, a great sense of appreciation for the work that you do.
I know from personal experience that to be true. My dad celebrated his 80th birthday this year. At the same time he celebrated his 80th birthday, he celebrated his 42nd year of sobriety. Our focus, to me, needs to be on the community mental health system and services so that folks don't have to get services as frequently as they do through the acute care system. So you'll see that. I will tell you the budget ask will not be as significant as some folks would like. But I'm a guy who's willing to keep taking bites of the apple until I finish the apple. I think it's a little bit unrealistic. We went through an exercise last year where we did a needs assessment. We asked providers to send us back what they thought the budget request ought to be, and the number that came back was $660 million. Well, that's more than I currently have in the system right now. So for me to go down there and make that ask, that's the same as not making an ask, okay? Because it just would be tossed out. But we will look at this. I do think we're making progress. I think the legislature is very interested. I think leaders within the legislature, including Representative Peters, I have this as a top priority. So I am so hopeful that we are going to see some real progress, both in terms of the reforming some of the processes within the system, but I think you're going to see, when all is said and done, a significant shot in the arm in terms of resources this year too. It won't get us all the way there, but it's gonna be the first big bite of the apple. We are absolutely committed through the executive order to keep working through these issues, and there may be recommendations both in terms of process but also in terms of budget that come out of that approach as well. So for those of you folks doing this work every day on the ground, hang in there. I truly believe it's going to get better. The future's going to brighten. And I'm so happy to have Central Florida Behavioral Health Network as our managed entity. And I think it's because of their willingness to partner, their willingness to be innovative, their willingness to get out of the box sometimes to make things happen. I also think it's because the provider network that is Central Florida Behavioral Health Network, I think, is second to none.